I'm Sarah Miller, and I'm in a group with Anissa Quintanilla and Emma Visser, and we chose Spondylolisthesis. So a quick overview of what spondylolisthesis is. It is some sort of spine instability. It's where the vertebrae in your lower lumbar section ends up slipping out of place onto the lumbar below, which causes pressure on some nerves, which often leads in pain. It is a very common condition because over 3 million cases per year happen with people who have spondylolisthesis, and some people don't even know that they may have it because sometimes that nerve doesn't get pressure, so you don't feel the pain. Some causes and risk factors about spondylolisthesis is the most common one being overextension of the spine. That could be due to like athleticism or playing sports. It could really happen in any activity that you do. Also, genetics play a factor, as some people are born with like a thinner section of vertebrae, which tends to be the one part of your lower lumbar section that ends up breaking and causing the slippage onto a nerve, causing pain. Wearing and tearing on the spine of disc of older adults also is another cause and risk factor, because as you age past like the age of 50, you end up getting weaker in that little thin section of bone. And also athletes have a greater cause because sometimes you stretch that lower lumbar section in like sports like football and gymnastics especially, that cause that slippage to happen. So in that picture, it shows a lot of different grades. You have grade 1, grade 2, grade 3, 4, and 5. That kind of determines the severity of the slippage. So grade 1 and grade 2 typically don't need surgery. Rather, grade 3, 4, and 5, you'll need surgery because it just looks really bad. For symptoms and assessments, some people, like I said before, don't have any symptoms, so they could go their whole life not knowing that they have this condition. But for people who do find out that they have it, they tend to experience pain in their lower back, which can spread to their butt and then their thigh, and then further down to their legs. They may also experience some numbing and weakness or tingling in the foot, or muscle spasms in the hamstring, along with they may have difficulty walking or standing like past 15 minutes about. And they can also have pain whenever they bend over or back stiffness, and this ultimately just reduces their movement. So a friend of mine actually has a spondylolisthesis, and she went like 2 weeks like in a constant state of pain, always had pain in her lower back section, and she didn't tell anybody, but when she did decide to tell somebody about it, she found out that she had the condition, and then she went to PT to do some stretches, and then she also has a brace just to help her with stability in her back. For diagnosing this condition, doctors will typically have you take a physical exam just to feel around to see where your spine is. And they might also have you take an imaging scan, such as spinal x-rays or a CT scan and MRI scan, just to get a clearer look at the spine to see where it's slipping, how far it's slipping, and just to see what that soft tissue looks like. For treatment, there are a lot of non-surgical treatments like the back brace or physical exercise and physical therapy, which are typically what people do. This normally solves the issue with pain, but sometimes people still have severe pain afterwards, even though they may take medications like ibuprofen. And so when that happens, they will go to surgical treatment. And as you can see in the picture, those are some bolts to help stabilize the spine, and this will allow you to feel relief of that pain. Another treatment that people can also do is a steroid injection, so they just kind of put that injection in the area that is affected to relieve you from the pain. Prognosis and follow-up. The surgery does have a high success rate, so once people have the surgery, they will often return to activity within a few months of surgery, so they won't have like any follow-ups normally, maybe like once a month just to make sure that everything's still doing okay, but they will need rehabilitation as they get back to doing those activities, getting back to their regular day of life. And those are the sources.